Hello, I'm Alison Bale of Mind Insight, and thank you very much for joining me today on this journey into the common misunderstandings about pain. Why is this an important topic? Well, let's set the scene a bit. In a world where persistent pain affects a significant proportion of the population, understanding what causes it and what can make it worse and what can perpetuate it is really important in terms of self-management. To give you some idea of the scale, about 30 to 40% of the population of Britain, men and women, grapple with persistent pain. And if you're navigating the menopause or you're over the age of 75, that figure rises to 50%. And whether you're part of those statistics or whether you're someone who's caring for someone who is, this video is for you. What I'm going to talk about are three of the most common misunderstandings that people have about pain, and they're important because they're misunderstandings that can keep you stuck and can make recovery difficult. So I'm going to share some of the steps you can take to be more deliberate, more conscious, if you like, more awake, more aware of what's happening for you in ways that can help reduce symptoms and help you get more out of life. And the misunderstandings I'm going to cover today are that pain is always synonymous with tissue damage, that the amount of pain you're in reflects the severity of the underlying situation, and that there's some kind of magic wand out there, some one-size-fits-all that you just haven't got to yet. So I invite you to come with me on an adventure into the intricacies of pain. It's a common misconception that if you've got pain, that there must be damage to a muscle, to a joint, to a ligament, to a bone. And certainly if the pain is of recent onset and you've got redness and swelling to go with it, and if you know what you've done, then chances are, yep, you've got pain because there's tissue damage, and it's going to feel better in a few days as the tissue heals. But some people find that pain becomes persistent. It goes on for more than 3 months, and sometimes it appears to come from nowhere. And there isn't always an obvious cause or a clear disease. In fact, numerous studies on conditions like low back pain tell us that even detailed imaging like MRI doesn't always reveal the cause of the damage, or indeed reliably predict how much pain you're going to be in. Pain's a protective mechanism for your body. When your brain perceives that there's a need to safeguard you or to safeguard a particular area, you'll feel pain in that area. Now, pain always comes in two parts. There's the physical sensation and there's the emotional distress. And we can't always stop the physical sensation. It can be just a normal part of being a human being. But we can usually do something to address the emotional suffering. And one way to do that is to use an attitude known as acceptance. Acceptance encourages you, invites you, if you like, to to just recognize and acknowledge that an experience is here. So you might almost find yourself saying to yourself, pain is here. Hello, pain. As best you can without resisting it and without trying to tense against it. Because when you just acknowledge the present moment sensation in that way, it has the impact of just reducing some of our natural tendency to contract against the situation. And when we contract and tense and try and hold our bodies in that way, that can actually exacerbate pain. One of the ways you can practice acceptance, if you like, is to bring curiosity to your sensations. How do you do that? Well, you could ask your pain some unusual questions. What colour is it? Is it deep inside your body, or is it quite shallow? Is the pain still? Does it move? When you start experimenting with these questions, you just start to get a sense, firstly, that pain is rarely static or still. And it just allows you to explore the nature of what's happening for you without some of the tension and the holding that often goes with pain. Have you ever had a paper cut? Because if you have, you'll know that a relatively minor injury can give you a lot of pain. But conversely, a study on individuals with spinal cord damage showed the intriguing finding that there wasn't a clear correlation between the extent of the injuries and the amount of pain people were in. You see, the amount of pain we get is shaped by different factors. Yes, there's the physical element, and that's not just any tissue damage, but also our general state of health, any other illnesses we've got, and genetics plays a part. But it's also shaped by psychological factors, our beliefs, our feelings, and by social factors such as our support systems and how easily we can access care. Now, one of the ways to work with this idea that intensity doesn't always reflect the extent of an injury is to practice a habit called non-judgment. Now, non-judgment, it isn't quite what it sounds. We make judgments all the time. One of the problems with that is that we tend to automatically judge things, in the case of pain, as bad. And that traps us in automatic reactions. This is something I don't want, I don't like, and I want it to go away, and now would be good. And when we react in this habitual way, it can keep us stuck in the problem. So one of the ways to cultivate non-judgment in this scenario is to get to know your own inner dialogue. And one of the easiest ways to do this is just to write it down. When you've got pain, what's going through your brain? What's your mind telling you? When we write things down, it just, handwriting in particular, slows the brain down a bit, and it's easier for us to notice the inner dialogue. And once we notice that dialogue, we can start to question it. And this is what non-judgment is really about. It's not that you don't make judgments, but you do start to acknowledge whether those judgments are helping you or not, and whether you even know whether they're true or not. Are they open to question? Would there be another way of seeing the situation? And when you start to question the habitual reactions, you begin to open up choices for yourself. And that has the potential to diminish the duration and the intensity of pain. If only there were a magic wand, if only there were just one solution that worked for everyone. I tell you what, that would be really convenient. And not just for patients, it would be convenient for the doctors and the therapists as well. If we just knew what buttons to press. The truth is, there's nothing really very simple about persistent pain, and often getting a reduction in symptoms is about creating a sense of safety. And what creates safety for you might not be what creates safety for someone else. And in fact, sometimes what creates safety for one person may actually create danger for someone else. So if, for example, you take somebody with fibromyalgia, the symptoms of fibromyalgia are so varying and so broad that just because everybody's weathering the same metaphorical storm doesn't mean they're all in the same boat. And this is where an attitude of trust can be really valuable to you. Trust is about your capacity to delve into what works uniquely for you. And your individual experience is just as valid as the next person's. And I think it was the Buddha who told his disciples that they should take his teachings, but they weren't meant to be followed blindly, but rather applied to your own life and then work out what's right for you. Now, trust doesn't mean that you don't seek advice or that you don't seek to learn from others. But it simply means that any advice you get, you need to filter through the lens of your own experience and learn to trust what works for you and learn to believe in yourself. And one of the ways that you can do this is just think back in your own experience to times when you've maybe faced difficult situations before and you trusted yourself and you trusted your capabilities and it worked out. And see if you can go back into that experience deeply and capture how it felt in your mind and how it felt in your body. Because if you've been able to do it before, you can undoubtedly do it again. So to recap, we've looked at how pain doesn't always indicate tissue damage and how acceptance can help you work with that. We've looked at how there's often a disconnect between the amount of pain and the severity of the problem and the role of judgment in that, and how practicing non-judgment can be of benefit. And we've looked at the issue of how there isn't just going to be one solution or one magic wand, and that your capacity to experiment and to trust your own instincts, if you like, is going to lead you into the right solutions for you. Thank you for joining me on this brief exploration of some of the misconceptions about pain and how slippery pain can be. So if anything's caught your eye, you've got questions, you'd like to know more, I'm very happy to hear from you. And please do get in touch and do follow me on social media for more about how persistent pain can be helped and how you can reduce symptoms and how you can live well even with pain.